everyone, so let's move towards our today's topic, which is blood supply of brain. But before starting this topic, I would like to tell you something which is very much important, that you have to listen this lecture as well as the blood supply of spinal cord, because as you know, the central nervous system consists of blood and spinal cord. Okay, so blood and spinal cord together called as central nervous system. So you have to remember the blood supply of the brain as well as spinal cord. I am telling you first of all the brain blood supply of brain, because it's easy for you कि अगर आपको पहले ब्रेन समझ में आ गया ब्लड सप्लाई, तो आपके लिए ब्लड सप्लाई ऑफ स्पाइनल कॉर्ड समझना easy हो जाएगा. Now the topic is starts from like there are two vertebral arteries and two internal carotid arteries which are supplying the brain. Now first we will gonna talk about internal carotid artery. As you know, from the aorta, common carotid artery arises and then it runs in the neck region, and in the neck region it will divide into internal and external carotid artery. Okay, then the internal carotid artery will enter into the cranial cavity by passing through carotid canal and foramen lacerum. As you know that foramen lacerum and carotid canal are connected with each other, and internal carotid artery will pass through these foramen lacerum and the carotid canal, and then it will enter into the cranial cavity. And if I talk about that cranial cavity, that is middle cranial fossa, which we have already discussed separately. So middle cranial fossa में वो enter internal carotid artery हो गई. Now what happened? The internal carotid artery will further divide into anterior cerebral artery and middle cerebral artery. Okay, the anterior cerebral artery, obviously it will move in the anterior cranial fossa, and the middle cerebral artery will enter into the middle will remain in the middle cranial fossa. Okay, the anterior cerebral artery will supply the medial surface of the cerebrum. Okay, as you know, there are few surfaces we have already discussed in the lecture of cerebrum. So supralateral surface and medial surface and inferior surface वगैरह. So the medial surface is supplied by anterior cerebral artery. Okay, and the middle cerebral artery, which remains in the middle cranial fossa, will supply the supralateral surface of the exactly, it will supply the supralateral surface of the cerebrum. Now as you know, internal carotid artery right side से भी enter होगी, left side से भी enter होगी. So there will be the entrance of the internal carotid artery on each side of the middle cranial fossa, and then it will divide, and the anterior cerebral artery will also be present on each side, right side and the left side. So they will connect together by an artery called as anterior communicating artery, and you have to remember this point as well. Now, like I told you, that internal carotid artery will enter into the middle cranial fossa by foramen lacerum and the carotid canal, and they will divide into anterior and middle cerebral artery. But before dividing in that anterior and middle cerebral artery, they will give off some branches, and you have to remember those branches, the name of those branches. And when you memorize the name, you will easily identify the function as well. That is, first branch is ophthalmic artery. So ophthalmic artery will supply the orbit region. Okay, the second one is posterior communicating artery. Okay, the posterior communicating artery will interlink the posterior cerebral artery and the anterior cerebral artery, and I will tell you this posterior communicating artery in the after this internal carotid artery. After this topic, I will gonna tell you. But anterior, the third branch is anterior choroidal artery. As the name indicates, it will supply the choroid plexus. Okay. Now vertebral artery. Now we will gonna talk about vertebral artery. Like I said, two internal carotid artery will supply and the two vertebral artery will supply. Now vertebral artery will arise from subclavian artery, right and left subclavian artery. Okay, on each side vertebral artery will present and they will enter into cervical segment of the spinal cord. As you know, the anatomy of the vertebral column, vertebral bones. Okay, vertebrae. So in the vertebrae there is a region called as transverse process. So in that transverse process, that vertebral artery will run and it will enter into, as you know, that spinal cord will pass through the foramen magnum and then it will connect it to the brainstem and then afterward it is connected to the cerebrum. So vertebral artery will the right and left vertebral arteries will run with the spinal cord and they will enter through foramen magnum in the cranial cavity. Okay, but when they are passing through the spinal cord, they will also give some branches. Okay, and we will discuss these branches in the lecture of the blood supply of the spinal cord. That's why I was telling you that you have to listen the lecture of the blood supply of spinal cord, but before that you have to listen this topic. Okay, now what I was telling you कि vertebral artery enter हो जाती है foramen magnum के through cranial cavity में. Now what happened, those two vertebral arteries, right and left, they will unite after the foramen magnum, that is in front of pons, that is in front of brainstem. It will unite and form a single artery that is called as basilar artery. Okay, and before basilar artery, those vertebral arteries will gives the branch called as posterior inferior cerebellar artery, which will supply the posterior surface of cerebellum. Remember this point, which is very much important. The posterior surface of the cerebellum will supplied by posterior inferior cerebellar artery, and this is the branch of vertebral artery. Okay, now moving further, the basilar artery. Okay, now moving towards the basilar artery. Basilar artery is formed by the union of two vertebral arteries. Okay. Now what happened? The basilar artery will divide into two branches, two arteries called as posterior cerebral arteries. Okay, basilar artery will divide into two posterior cerebral artery. Okay, and those posterior cerebral arteries are connected with the anterior cerebral artery through posterior communicating arteries. Okay, basilar artery जा रही है. Then if you see the diagram, you will easily see that then after dividing into posterior cerebral artery, the posterior cerebral arteries are basically forming a U-turn. Okay, and through that U-turn there is a branch which is connected with the anterior cerebral artery, and that branch is called as posterior communicating artery. From basilar artery, few other branches are arising, that is anterior inferior cerebellar artery, which will supply the anterior part of the cerebellum, the superior cerebellar artery, which will supply the superior part of the cerebellum, the labyrinth artery, which will supply the internal air cavity. Labyrinth is the basically, as you know, membranous labyrinth and bony labyrinth we have discussed in the air part. Okay, so air के पास एयर के करीब आ रही होती है, एयर के पास जब ये एयर की लाइन में जब बेसिलर आर्टरी आती है, वहां से ये ब्रांच अराइज होती है लेब्रिन्थ आर्टरी. एंड द पोंटाइन आर्टरीज और पोंटीन आर्टरीज they will supply the pons. Okay, so you have to remember that how this course is happening. एक बार फिर ये लेक्चर सुन लीजिएगा, आपको कोर्स समझ में आ जाएगा तो आपको एक मोस्ट इम्पॉर्टेंट चीज समझ में आएगी. द मोस्ट इम्पॉर्टेंट थिंग इन द ब्रेन रिगार्डिंग द ब्लड सप्लाई इज Circle of Willis. Now, what is this? If you remember the course, you will easily memorize it. Now, I have told you that vertebral artery will enter into the cranial cavity through foramen magnum, and they will unite together to form the basilar artery, and then basilar artery will give off posterior cerebral artery, and those posterior cerebral arteries are forming a U-turn, and through that U-turn, remember this point, through that U-turn, posterior communicating arteries are connected with the anterior cerebral arteries. Okay? Now, anterior cerebral arteries are in the front, posterior communicating arteries are on the lateral side, and posterior cerebral artery are present posteriorly. Now, this is forming a hexagonal circle of the arterial supply, and this hexagonal circle is present in the center of the cranial cavity as well as in the base of the brain. Okay, below the cerebrum, okay, below the whole cerebrum, you will easily see, if you remove the cerebrum, you will easily see there is a circle of the Willis, and it is it is present in the center of the cranial cavity. So you have to remember these points. Okay, so boundaries आपको याद हो गई. Anteriorly क्या है? Anterior cerebral artery, anterior communicating artery भी कह सकते हैं. Posteriorly, posterior cerebral artery, and laterally, posterior communicating arteries are connecting the posterior and the anterior cerebral arteries. Okay, so this was the whole topic regarding the blood supply of the brain. And one more time I am saying, do not forget to listen the lecture of the blood supply of the spinal cord. Till then, work hard, study hard, and good luck. Bye. Take care.